Welcome to the Wellness Reset. This is an episode that most of you have been waiting for across India and across the world. And today I have a very special guest who's so busy, but yet he's given us time to be here. Dr. David Chandy, thank you so much. I would love for you to talk about the impact of our breath or even, things like anger, emotions, which is chronic stress on our blood sugar levels.
So there are these two hormones which have a very strong correlation with blood sugar. One is cortisol and one is adrenaline. So when you're chronically stressed, that means you're stressed for days, the cortisol level goes up and this traps the energy or traps the sugar in the blood. So your sugar remains high. Second is short-term stress. This triggers the adrenaline rush. So again, this makes the sugar go up, makes your heart rate faster, makes you breathe faster. So there have been multiple studies that have shown that if you have some peaceful practices like deep breathing, meditation, and you calm your nerves, you are more relaxed. It improves your sugar, your blood pressure, your heart rate. There have been multiple studies that have shown that if you have some peaceful practices like deep breathing, meditation, and you calm your nerves, you are more relaxed. It improves your sugar, your blood pressure, your heart rate. So people who are very stressed should just try some of these things. Simple deep breathing, meditation, and have a rhythm in place. Like, if you always eat on time, have similar meals, sleep on time, and learn to let go. Many times, people have that possession that, I'm very worried because of XYZ thoughts, and they keep holding on to it. You need to let go. With that, easily your metabolic health would improve.
Doctor, you're one of the first doctors on our show who has used this word rhythm. And I really like that because part of our practice, we're trained on circadian medicine, which is all about rhythms. Align your sleep time, align your breath, align your eating times, align your poop times, etc. And once there's rhythm in the body, homeostasis, everything works in an intelligent way. So thank you for mentioning that. Doctor, I want to get straight into Mounjaro, Ozempic, all of these weight loss drugs which have come in. We've seen some patients who were probably time bombs until this drug did come in, 140 kilos, 150, metabolic syndrome, high blood pressure, etc., etc. They're down today by 100, vitals are in place, everything is great. But at the same time, there's a lot of misuse of this. I would love for you to talk about, these drugs, etc. Who needs them? Who were they designed for? And how can we bring mindfulness and science into making the right decisions? Because a lot of people, if their doctor doesn't give it to them, they're going to someone else who gives it to them. If they're not getting it in our country, they're going out of our country where people are happy to administer the drug. And what's worse is we have seen the outcome of the misuse of this drug when these patients come back to us. They've not taken it the right way, or they've taken it without making changes, etc., and they have new problems. So I would love for you to throw light on this, please.
So we'll start from the history of this. So way back in 2005, there were these drugs that were found. They were called GLP-1 agonist. So they have almost a 20-year history now. And they were initially detected to get the blood sugars down. And then, way back in around 2017-18, they showed that one of these molecules, that is semaglutide, at a higher dose even reduced craving for food. So the pleasure that you get from eating food comes down. It makes the stomach a bit lazy. So you eat little and your stomach does not expand. So you don't feel like overeating or taking the second helping. And third, like other drugs in that group, it gets your sugar down. So they realized that maybe like at a higher doses, it would improve with weight loss. So there have been multiple studies done from 2018, and now there's two molecules. Your Ozempic, which is your semaglutide, and Mounjaro, which is tirzepatide, has good amount of data to get the weight down. So it's mainly indicated for people with a body mass index above 30 or someone with a BMI body mass index about 27 with some comorbidity. What do we mean by that? Is someone who has a borderline weight plus they have maybe obstructive sleep apnea, fatty liver, diabetes, high blood pressure or knee pain because of weight. So in them, when you take this, gradually over the next 1 to 2 years, the weight comes down and there's good data. It is found to have multiple other benefits, like it reduces the heart risk, it improves the kidney function, it has amazing results to reduce fatty liver. Because all of them are related to the visceral fat. So when the visceral fat comes down, your insulin resistance improves, the load on the all other organs like liver, heart, kidney, all reduce. But the thing over here to remember is, take it in the correct way. Many people try to jump the gun. So what I tell patients is, remember, it's like completing a marathon. You're not doing a 100-meter race. So some people come and say, I have a wedding, I have, a party, I need to lose 10 kilos weight in 3 months.
Yeah.
So they are asking for trouble. They may sometimes, misuse it. They may start at a higher dose, or they may quickly escalate their dose, and then they may land up in side effects. So we tell the patient, this is a scientific drug, use it in a scientific way. We always start with a low dose and we go slow. So if you go low and slow, you will not land up with side effects. Don't hurry up with the dose. Don't look for immediate, results. Our goal is to be lean and fit. Some people who take with very high doses, and those who don't follow a lifestyle, they don't focus on food, sleep, exercise, they become lean and frail. We don't want that.
Yeah.
So if you want to be lean and fit, please focus on the food, exercise and sleep.
I think muscle loss is a concern, and if people don't change their nutrition and macros, that's what we've been seeing in people who abuse it. And like you rightly said, people using it for a short term. I have a wedding, I need to fit into a dress, etc. I need to look good for a holiday. Doctor, I also wanted to talk to you about, there's a lot of media showing that, people have taken Ozempic and now they're losing their memory, they're getting this, they're getting that. I would love for you to throw light on that, because again, that's social media, whether it's right or wrong, whether it's noise, but I would like your scientific thought process.
So how do we negate or mitigate it is, again, like whenever we look at the literature, these complications are more in people who started off with higher doses. So never be in a hurry, always start with the lowest dose. Second, where there was tremendous amount of drop in the weight or drop in the sugar, be it any complication like the muscle loss or the stomach being lazy, which is called gastroparesis, or some rare complications like the blood supply to the eye, which is being reduced. All of them correlate with drastic weight loss or with drastic lowering of the blood sugar. So remember, we are never in a hurry. It's always good to start low, go slow.
Right.
With that, most of the complications can be avoided, number one. Second thing is the balance of your food. Make sure that your carbs are less, but make sure there's a good amount of protein and the weight training.
Yes.
So with a good protein and good weight training, there won't be significant muscle loss. It will be a very marginal muscle loss. The third thing is, many times patients who take this forget to drink water. So if you don't hydrate yourself, you will then land up with low blood pressure, dizziness. The last thing what we see is, this is a very medicine which is very sensitive on your stomach and intestine. So be careful in what you eat. Like I had one patient, who went for a wedding and had a lot of pani puri. And then she landed up with stomach infection and she had severe diarrhea. So don't eat something that can cause food poisoning.
Okay.
So these are the 4-5 points that we counsel the patients well.
That's amazing.
And make it sure that, they have understood these concepts and then they do well with the medicine.
So, doctor, can there be possibilities, because I've seen a couple of cases who have come and say, hey, Luke, Mounjaro is not working for us, Ozempic's not working for us, etc. I will be honest, I'm not the medical expert there, but I find various gaps in their lifestyle, which could possibly be, we always believe that if you have a great lifestyle, there's a possibility that your medications can be way more effective. We see that with chemotherapy, radiation. But I wanted to ask you, are there cases that you see where it doesn't work on people, and what would those reasons be?
So we would classify them into two groups. So even in the data that has been published, we see that around 5%, to 10% people, it doesn't work. So there could be some genetic reasons. Their metabolism would be a bit different. For some reason, they would be like resistant to the action of the GLP-1. So gradually, we are going to have newer generation of these molecules, which would try to, work on this resistant group. Second could be like, practical reasons. One reason that, initially in Mumbai, there was, the issue that, people would not get it. So they would, go and get it from a different country, and maybe it is not stored properly. So if you don't store this medicine properly, it has to be stored in the fridge and you need to use it properly. The second is the improper technique. Some people would not take the proper technique. They would, only inject half the dose.
Okay.
So this is the technical issue. So whenever there's a patient in front of you, it's very important that we educate them properly, how to purchase it, where do they take it, how do they store it. So all these technical things are important. So never be in hurry with a patient, tell them just take this medicine. So we had one patient, who was half of the drug he would administer outside. He would take it out quickly out and half of the drug would fall out. We had one patient who was not storing it in the fridge. So then we realized that these were the issues. And once they were rectified, it improved quite well.
Dr. David, thank you so much. It's been a pleasure. I hope all of you have enjoyed this episode on the Wellness Reset. Again, Dr. Chandy is available at HN Reliance. He's a very busy man, but he will give you that time. I appreciate you giving time to all of our patients and counseling them on lifestyle as well. Remember to hit that subscribe button so that you get the whole episode and you don't miss any more of our experts coming on this show. Thank you, Doctor. It's been a pleasure. Thank you.